Hi again, I'm Carin Weiss-Krolikowski, founder and partner at firmTRAK Solutions, and I'm joined today by Ryan Oltman, another partner and founder at firmTRAK Solutions. And we wanted to just kind of talk a little bit today about the changing of the tides, so to speak, in healthcare insurance. There's a couple of things that are going to happen coming up in 2026 because of the closing of Health Alliance. And this will vary state to state. So I'm going to talk specifically about Illinois. So in Illinois, Blue Cross Blue Shield is basically a monopoly now since Health Alliance has folded. And starting next year, their premiums have gone up 150%. I know for myself, I was paying a little less than $400 a month for health insurance, which on its own face value is still kind of pricey. But next year, if I want full coverage health insurance, it's going to cost me $1,500 a month.
And that's
which means that totals out to $18,000 annually. And there's no tax benefits. If you make over $60,000, there's no subsidies. There's no tax relief. There's nothing. So my advice, keep track of your receipts. You may have to go a different route like I did with just the catastrophic health insurance, which basically implies that if you're hospitalized, then you're 100% covered. But all of your doctor's visits, prescriptions, everything's going to be self-pay out of pocket. And I think that it's a real shame that this healthcare policy has failed, but fail it has. What's your take on it, Ryan?
Yeah, and I'm looking at an article from the BBC, and we're in the middle of open enrollment that started November 1st. And just to clarify a few things, like the Affordable Care Act or Obamacare subsidy was ended. How the play-by-play of this worked is under Biden's administration. This is my understanding, so it could be a little bit different. I'm paraphrasing sort of what I remember. Under Biden's administration, in order to pass their infrastructure, the Build Back Better bill, Joe Manchin made them put a 1-year expiration date on the ACA subsidies that, with the income test, under a certain amount of income, Carin mentioned 60,000, you would get a subsidized cost that they would give you a tax credit on your tax return. Your out-of-pocket was reduced by as much as 75%. When that came up for renewal under Trump's term, they cut that out under his big bill that they passed. And they even shut down the government for like 36 days, ostensibly to negotiate on putting the subsidies back in. And they caved, or they failed, or the negotiations didn't pan out. Those subsidies are now gone. Households making around 60,000, the limits may be slightly up or down. But there's no longer any subsidies, so you're absorbing that full cost of that premium, which it equates to a large increase. Like Carin's experience, hers went from whatever it was to 150%. I haven't actually completed my open enrollment because I knew this was happening. I kind of been putting it off to the last minute. I assume it's going to be similar. Before, I was paying around $500 a month, and I've gotten a quote at $1,100 a month in our household. So that's basically a doubling of the premiums. And people are really going to have to make decisions in their own households of what they can afford and what it's worth, and really the overall health of and what they need for their health care. And it's really, a big deal. 24 million Americans are on the open marketplace. It affects us small business owners who don't have group health insurance plans because we're not big enough. We're a small shop, and it's really going to affect a lot of people. And the future of healthcare in America is now open question, because who knows how many people are going to be able to just come up out of pocket at a doubling or tripling of their prior year rates. So with all that being said, don't be like me. Don't do it Don't do as I do as I say. Go through your open enrollment and figure out a plan, because it's coming up. We're already almost to Thanksgiving, late fall here, and you're going to have a plan for 2026 care coverage, and it's going to affect your business, your household income, and everything involving money moving forward. So
leave us a comment on what your experiences have been.
Yeah, what are you guys dealing with in your household? Post a comment. Send us an email at firmTRAK.com. Let us know how you're handling it.